Hi, everybody. About, let's see, how long ago was it now? I think maybe a month or so ago, I posted a video about chronic sore throats and how that can sometimes be a clue that there might be some more nefarious underlying cause that might be contributing to a person's chronic fatigue or neurological symptoms, chronic pain, autoimmune disease, et cetera, et cetera. And so someone posted a question on that video 4 days ago, and thank you for the question. And so it's a multi-part question, so I'm going to read it out here. So it says, what are your usual suspects for chronic sore throat? You did mention strep and mycotoxins, how the mold toxins can maybe indirectly affect a sore throat, where we're swallowing those postnasal drip secretions that might be laden with mycotoxins in some cases. In terms of other usual suspects, I don't really have that many other usual suspects per se. I mean, one could make the argument that maybe a chronic viral infection with, Epstein-Barr virus or Coxsackie virus or HHV6 virus or something like that could potentially cause a sore throat, because of course many times when we get these upper respiratory tract affecting viruses, we might get a sore throat with that, but I can't say that it's a common thing that I've seen in my practice. Now, with that being said, it's always a bit hard to say what's necessarily causing the sore throat, because many of the therapies that we use have a multimodal activity. So for example, if I prescribe to one of my patients, and just as a quick reminder, nothing I'm saying should be construed as medical advice. This is for informational purposes only. Please talk to your own clinician if you need some medical advice. If I'm recommending for one of my patients using, say, a diluted frankincense essential oil throat spray, and they feel better from that, well, am I killing off a virus? Am I killing strep? Like, who knows? It's just so broad spectrum. So I think there's more question marks around it than there are definitive answers. But I'm typically thinking about strep, maybe mycotoxins. But at the end of the day, if I see a kind of a systemic infection picture or a suspected systemic infection picture, and there's a sore throat component, I'm probably going to treat the throat anyways if it's not getting better on its own. So we don't always know what the cause is of that per se. Let's see here. And so the person said, right, so the person said they have EBV, Bartonella, and Rickettsia on their list of, maybe suspects. Yeah, possibly. Could be those. And then further question here, do I test with a swab? No. If I think a patient has acute strep throat, then or subacute strep throat, then I certainly recommend doing a swab. But generally, if it's a chronic sore throat, I don't recommend doing a swab. It's not that it would be an incorrect thing to do. It's just the testing options for that are not super readily available for the majority of my patients who are in Atlantic Canada, where I practice. And also the treatment, again, is going to be kind of the same, whether it's a strep overgrowth or we find some other type of microbe overgrowing. It's going to be typically broad spectrum antimicrobials. But a swab is always interesting to get those done. Then it says here, strep usually gives very intense symptoms, which may require penicillin. Do you also see mild symptoms with chronic strep? Yeah, definitely. So some patients with chronic sore throats definitely have severe symptoms, but for the most part, it's usually a mild or moderate sore throat. It may not be there all the time. It might wax and wane a little bit, but it's usually not a front and center, like, oh my gosh, like it's like swallowing razor blades every time I swallow, type, strep throat. And then it says, lastly, if someone is on antibiotics, would this be enough to deal with a throat? I assume you mean deal with a chronic sore throat. It could be. It would depend on the antibiotic. It would depend on the causal microbe. It would depend on several different factors. By and large, I find that a lot of the patients that I work with, when they've been on antibiotics, sometimes on multiple antibiotics, unless the antibiotics have knocked it out of the park before they get to see me, which oftentimes they haven't, because that's why they're coming to see me, then the antibiotics do not seem to do a sufficient job going after the chronic sore throat. And I think that it's in large part because it's, for most patients, probably not necessarily an active infection in the traditional sense of things. It might be more of an immune system dysregulation that's affecting that tissue in the body, where there's just, say, a normal amount of strep back there, but the immune system has kind of become hypersensitized and it's having this overblown inflammatory response. And that's a concept that I've talked a number of times about in past videos, where I talk about low dose immunotherapy, because that's the main thing that therapy addresses. And I've also talked about this in other videos where I talk about the pathophysiology of Lyme and co-infections, and how they ultimately will sort of flip the switch on the immune system to put it into a chronic inflammation mode instead of an anti-infectious mode, and that will cause an overblown inflammatory reaction to a microbe that doesn't effectively kill it off, but it can make the tissues in question really cranky. So if a person had a hypersensitivity reaction to strep, and there's strep naturally living in the throat, excuse me, in the sinuses, on the skin, any of those areas could become targets for an overblown inflammatory response, and then low-dose immunotherapy or an analogous therapy could be very helpful. So thank you for the questions. It's a fun topic to talk about. Not a lot of folks talk about chronic sore throats, and I think strep is really an underappreciated component in not a majority of chronic cases, but definitely in a significant number that I've seen. So always fun to talk about this. If anybody has any questions about this topic or anything else, please post in the comment section below, and I will leave it there for now.